Well. Good morning. Happy Wednesday. Topic today, I want to bring up something that's going on. It's impacting a lot of people in different ways. Is the government shutdown, right? It's a big talk of what's going on. So obviously they need to come to a decision to figure things out. It's like a child's game. I don't understand it. But anyway, here's what it's doing to healthcare. Okay. Federal health agencies, yes, they will. So the CDC, the NIH, FDA, CMS, basically other face partial or full closure or non-essential services. Okay, so staff is deemed non-essential. What happens is they're furloughed, meaning they stop working and they're not paid until the government shutdown's over. So I understand how this impacts other people in other industries, but my dad's an air traffic controller, so a lot of my family is. So obviously they're with the government, so when there's a shutdown, they're not paid. But anyway, Medicare and Medicaid. These are actually mandatory spending programs, so payments, coverage continues as usual. There's nothing different there. The biggest thing is the support staff that gets furloughed, and it makes it difficult for them to do everything they need to do in order to keep things moving, keep their business moving as normal. Hospitals, healthcare providers, well, there's delay in federal grant payments, okay? For a lot of your rural health, community clinics, your FQHCs, they rely heavily on those grants, so that they can stay afloat. VA hospital clinics, they actually generally stay open because VA is funded under a separate entity. But obviously the administrative side will slow down because certain people are moved out of their position. Public health programs such as WIC, SNAP, IHS, Indian Health Services. Obviously with WIC, they can lose funding quickly. Some states may have reserve funds for a few days or weeks, but and then you have SNAP, which is food stamps, typically funded for a short time, but prolonged shutdowns can really disrupt the benefits. Indian Health Services continues they'll continue emergency care, but elective preventive services they put on hold. Research, innovation, so NIH and NSF grants aren't processed during the shutdown. So academic medical centers, depending on federal research dollars, they may need to halt or even self-fund to keep ongoing studies moving. Economic workforce ripple effects. Well, healthcare contractors and suppliers and service companies tied to federal work may experience cash flow issues. So physician recruiters, staffing agencies serving VA, military, or federally funded clinics can see a delay in contracts or payments, which we already know that there's a delay in payments when it comes to working with the government. But their motto is hurry up and wait, and that's okay. Biggest thing is you will get that money. It just takes a little time. So the shutdown doesn't just impact a couple people. It doesn't just impact the politicians, okay? The shutdown impacts a big part of the world. In fact, one of my colleagues, their sister was furloughed because she works with the Air Force and works with the military. So this does make an impact to people. So for the people in DC, get yours together. And for anybody out there that needs locums help, see, Nortec, we're keeping it together. And we're going to keep our focus where it belongs, and that is going to be supporting providers to keep care moving. So if you are in need of locums coverage, whether you're a hospital, clinic, and you're looking for help, you need vacation coverage, you need weekend coverage, you guys are burnt out taking call, give Nortec a call. We'll help you out. If you are a healthcare provider in the market looking for different opportunities, give Jon Harvey a call. I got you. Till next time.